Hello, everyone, and thank you for checking us out. I'm Dr. Jason Lohr. Many of you may know me as the CEO at SAC Health, but I'm also a practicing family medicine physician. Our question from today comes from Tina. Tina says, I'm in my late 40s and have started having irregular periods, hot flashes, and mood swings, but I haven't technically stopped my periods yet. What is the difference between perimenopause and menopause, and what should I know about hormone replacement therapy? Well, Tina, this is a great question. Many of our patients are dealing with this, really trying to differentiate between what is kind of normal for them versus what time are they transitioning into menopause. So let's just define the two. Perimenopause is a time that can happen several years before menopause, where you may start having irregular periods, where there may be some symptoms that are going on, including hot flashes that you may be feeling. And that can start happening even multiple years before menopause. Whereas menopause is actually when the periods stop and have been stopped for 12 months. So it's already a full year after the periods have stopped, and then we would call that officially menopause. So it's very important to differentiate between those two. Now, there are a lot of symptoms that can come with both perimenopause and menopause, and typically those symptoms will get worse the farther along you are, and once you hit menopause, then those symptoms will typically be more than they were previously. If those symptoms are causing a lot of problems, there is treatment available, and we use hormone replacement therapy. Now, hormone replacement therapy has gone through a lot over the decades. There was a time where we gave it to everybody. This was decades ago. And then there was a time where we literally stopped giving it and was only giving it to a select few individuals. And now we're actually back and giving it to people really based on symptoms. So again, the key is how severe are the symptoms? How much are they affecting your life or your ability to function? And if the symptoms are severe enough, moderate to severe symptoms, we would recommend hormone replacement therapy. Now, there are multiple options for hormone replacement therapy, but we typically recommend the lowest dose of hormone replacement therapy for the shortest amount of time. And typically we recommend that before the age of 60 or within 10 years of going through menopause. Those are really the classic times that we would want to start that. And again, using it for the shortest amount of time possible. It's very important. It can help with those moderate or severe symptoms that can include everything from hot flashes to even vaginal dryness and other symptoms that can happen. Please know that there are side effects to the hormone replacement therapy. So again, we want to assess all of those. And some of those side effects that we can have include blood clots and stroke. So if you have a history of blood clots or stroke, we may be hesitant to actually start a hormone replacement therapy with you because there is a small associated risk with the hormone replacement therapy. The other is breast cancer. Again, a small risk associated with breast cancer. And so timing is really the key here when we know that those risks can exist. So again, this is so important for you to talk to your primary care doctor about, or your OBGYN doctor about this, because they need to assess all of your medical history to make the right decision that is best for you. Thank you for that question, Tina. It's a great one. Really appreciate it. And thank you for joining us for this episode of SAC Health Answers. Remember, your primary care doctor is your partner in healthcare. Thank you for joining us on this episode and hope you can join us again.